Hi everyone, my name is Lindsay and I'm going to be presenting on stress injuries. Stress injuries are something that have impacted my life personally as well as my boyfriend, who you'll see to the right there in the wheelchair. John dealt with two stress fractures in his left and right femurs his junior year of college, and I personally had a stress fracture my freshman year of high school, so I'm very familiar with this type of injury and I hope that I can teach you something throughout this presentation as well. So what is a stress injury? A stress injury basically comes from an overuse of a weight-bearing bone, repetitive stress on that bone. It's chronic. It's over a long time. It's not something, that's like a regular fracture, a regular break where it happens pretty traumatically or pretty quickly. It is caused by just over time using that bone and really not addressing that problem. So basically what happens is microfractures in the cortical bone tissue kind of splinter that bone, and as you'll see in the image on the right, most of the time the fracture does kind of happen horizontally throughout that piece of bone. It can happen in any bone, but the most common obviously are those weight-bearing bones. So according to the American College of Sports Medicine, 1 in 6 of all athletic injuries are stress-related injuries. And again, they're the result of basically excessive training, inadequate rest, an increase in intensity or volume too quickly, muscular weaknesses, imbalances, and early specialization of sports. So it can become a complete fracture if it's left untreated. So that would be the crack goes through the entire bone. But many a time stress fractures are able to be caught. There are warning signs. So hopefully, your coach or your athletic staff can catch that pretty quickly. And as teachers, we can recognize some of those signs and symptoms that I'm going to talk about as well. Stress fractures are most common in runners, gymnastics, and female athletes in general. My boyfriend and I are both runners, so that's the reason that we both experience them. But they're very common throughout other sports, and it's just really those sports that repetitive nature is very common in. So the next slide, this kind of says some of the signs and symptoms. So I'll actually get into that picture in just a second, but some of the signs and symptoms that we look for in stress fractures are local tenderness, pain with loading, running or walking, pain at night when you're sleeping, any kind of deep groin pain, a difference in gait. Are you limping? Are you favoring one side? Pain during and after activity. And then these signs and symptoms, if caught, can be diagnosed formally by x-ray, MRI, or bone scan. So that picture to the right is actually the real x-ray of my boyfriend John's femurs. So you'll see I put a comment about crack initiation, and so on that left femur you can clearly see that big crack. That was the first femur he fractured, and definitely the more painful one. So he had a lot of deep pain in that groin area. And then this right one came about a month later as this continued to be untreated, and you can kind of see the smaller crack, kind of inflammation in that right femur. Obviously, we're speaking anatomically. So basically, it was difficult for us because John was in college at the time and he was running for his college team. He was running very well at the beginning of the season. When he started to have some of these pains, he did go to the training room. They told him time and time and time again, even the team physician told him that this was muscular related. He was having pain in both sides. It couldn't, be a bone by any stretch. So they kept giving him stretches. They told him to roll out. They told him to take pain medication. I remember, being the one to kind of roll out that thigh area, and him being in excruciating pain. But we continued to do what they told us because we didn't know any better, and of course we didn't think it was the bone. Again, if it was both sides, so we treated it as muscular, and then finally got an X-ray that showed that both of those bones were cracked. After he raced 8,000 meters of his cross country championship on both. So definitely a rough couple months, but we have a ton of experience in this area. And then the next slide is talks about treatment and recovery time. So typically for a regular stress fracture, we're talking between 4 and 8 weeks of stopping whatever that repetitive stress-related activity is. For John, he ceased all running on November 8th of 2019 and was able to resume running on February 14th of 2020. So for him, it was 14 weeks. Whether that be the femur, being a bigger bone, being a kind of a more major injury, or it being a double fracture, we're not sure, but he did need that time to recover fully from his fractures. So, a couple of the treatment measures that they take when you have a stress fracture, because stress fractures, like I said, can pretty much occur anywhere, but they are very common in the legs. Over 50% of stress fractures occur in the lower leg and foot. So they do say protective footwear helps with treatment, casting or bracing, physical therapy. John is shown in that picture getting his physical therapy. And there is something that was called a bone stimulator that we got to use. So bone stimulators promote bone healing by applying an external energy field to a broken or fractured bone. So basically it mimics the aspect of the body's natural healing process. So for John, we had to do 20 minutes each leg every night, and that helped his bone kind of recover quicker, and fed into that natural healing process. The worst case scenario for a stress fracture, especially if it turns into a complete fracture, is surgery. John and I did go see a surgeon down at Rothman in the city. They did a consultation, and thankfully surgery wasn't in the cards for us, but I know that for other femur fractures, after, doing some research, and more serious, fractures and complete fracture surgery is common. So recommendations from the National Athletic Trainers Association, they basically say that, injury surveillance and research needs to be done on like a better basis. More research needs to be done on stress-related injuries in general to kind of figure out how we can better prevent those and how we can better treat them and get athletes obviously back to the field as quickly as possible. Risk factors, basically they say just look for warning signs, whether that be something like a leg length discrepancy or joint immobility, that we can see early on and try to correct in order to try to prevent stress fractures and stress injuries. Physical exams prior to competing, so they're basically called like preseason physical examinations. They say if you do those before competition begins, before your season really starts, you're able to better screen each athlete for those risk factors, for stability, for bone maturity, and try to catch things early, or at least have a baseline to compare to when these, injuries do happen. Obviously, coach education, medical supervision is an important aspect. So coaches and teachers need to stay educated on, warning signs, symptoms, treatment measures, rest and recovery time. Medical supervision is important unless they're telling you that it's the wrong injury for a long time. And then strength and conditioning programs, obviously, as phys ed teachers, we all know how important those are. And then sport alterations. So I actually found an interesting fact that NADA says that kids shouldn't practice for more than 16 to 20 hours per week. And these are like young athletes, obviously not professionals, but I thought that was a lot of time because I am a, competitive runner. I ran Division 1 in college and I still compete post-collegiately, and I could tell you I am training nowhere near 16 to 20 hours a week. So I thought that was a really big number for little kids to practice. And that kind of ties into the next point where delaying sport specialization is important as well, and that is something they recommend. So you want to encourage kids to do multiple sports. You don't want them to like specialize and spend all their time doing one sport. So I feel like those two kind of tied together because I feel like you do have those crazy families who want their kids to just be super athletes and they want them to train constantly and train, specialized and not let them do anything else. And so it's really important, just to make sure that kids get a little bit of everything so that they're not doing that repetitive, stress all the time, putting that stress on their bones all the time. So I just put a couple pictures up on the slide that I thought were cute. They're, young track athletes, young soccer athletes. But again, it's better to kind of have those kids do a little bit of everything. Prevention of stress-related injuries. So basically, you just want to make training adjustments gradually. You never want to increase the volume or the intensity of any type of exercise too quickly. When you change surfaces, you want to do it carefully. So if, for say you're at school all year and you have a dirt trail to run on, and then you go on a week-long vacation to the beach and there's only pavement available. You want to just be careful, because that change from soft surface to now very firm surface could definitely trigger a stress reaction or a stress related injury. Keeping up on your equipment, again, making sure that you have the proper footwear, just taking care of your body, making sure you're rolling out after, a gymnastics practice or after a run. Checking correct form. So I put a little graphic of the correct running form at the bottom. It's pretty cool. It points out like where your arms should be and how your posture should be, and where you should be landing with that foot strike. Intaking enough calcium and vitamin D. Using caution when transitioning between seasons. Again, intensity. Cross training, making sure that athletes do cross train, make sure they do several sports, at least when they're younger. But cross training is important all the way up to the pro level, so making sure you're swimming, biking occasionally, and take breaks when you need to. A lot of coaches don't allow their athletes adequate breaks, and that definitely is a cause of stress related injuries. It's just too much on an athlete. And again, switching up footwear, shout out to my friend who is the local Hoka rep. Hoka's a great shoe, very cushioned, has a nice rocker midsole. So super awesome running shoe. It's one I run in. So check it out if you have some time or you're looking for a new sneak. And lastly, what can be done? So as a current coach, I always stressed my athletes the importance of taking care of their body, and that is inside of practice, outside of practice, at home, getting enough sleep, getting enough hydration and nutrients, and making sure that they're eating enough. So that, as a whole, I think is the best way to try to prevent a lot of these stress-related injuries. But if pains do come up, I encourage my, athletes to let me know. Even little pains can lead to something really big. Obviously, John's pain tolerance was amazing. I don't know if that was a good or bad thing in his case, because those fractures definitely got worse the more that he ran on them. So it's important to encourage your kids to talk to you and just open up with honesty. And then make sure that you're training appropriately and you're using that gradual increase in speed and volume. You're not working your kids too hard. You're not giving them enough breaks. You're not, jumping into things too quick when a season starts. Yada, yada, yada. So, as a physical education teacher, I think it's awesome that we have the ability to educate. We have the ability to, teach kids some of these prevention methods, some of the signs and symptoms, so that they can recognize things when they show up, whether it be in school or it be at practice. And then I thought it would be a cool idea eventually one day to be able to have like part of my physical education program work on potential weaknesses and imbalances. So if I could be a little bit more knowledgeable on that and basically be able to kind of point things out, I could be in touch with the coaches and hopefully be able to help kids work on those imbalances before they get to the point of injury. And then lastly, as a teacher, we're able to be an ear and a support factor for kids. And not all kids, like we know, go home to a supportive household. Not all kids have a supportive coach, or not all kids feel like they even have, support in their peer group. So it's important as a teacher to be that support factor for kids to lean on. Ending on a high note, again, that's John. That was his first run back. We ran at the Haverford Trail, so we were on soft surface. That's Valentine's Day of 2020, so that was the best Valentine's Day present I could get. And it was just really amazing to watch him go through the recovery that he did. We learned a lot about the injuries. We learned a lot about, how to better take care of our bodies, and it really pushed us to be better athletes and more dedicated athletes in general. So at this point, he is back to running his normal speeds and volume, and it's been a crazy climb, and I'm fully healthy as well, so we thank God every day for that. And thanks for listening to my presentation. I do have my references listed. I'll pause for a second so you guys can check those out. And other than that, I hope you have an awesome rest of your summer, and thank you for listening. Take care.